Welcome back to Nandhini's Nurse's Nest. Today we are breaking down everything you need to know about edema, from the underlying conditions to seek immediate care if they experience rapid weight gain of 2 to 3 pounds within 24 hours, sudden shortness of breath, especially when lying flat, or chest pain accompanied by a persistent cough with pinkish phlegm. When these present, do not wait. So, what exactly is edema? Put simply, it is the abnormal accumulation of fluid within the interstitial spaces. This happens due to an imbalance in fluid filtration driven by four primary mechanisms: an increase in hydrostatic pressure pushing fluid out of the vessels, a decrease in plasma proteins like albumin lowering oncotic pressure, increased capillary permeability making vessels leaky, or a lymphatic obstruction that blocks normal fluid removal. Edema is widely classified into two types. First, we have pitting edema. The key characteristic here is a lingering indentation left in the skin after applying pressure because excess fluid in the interstitial space is temporarily pushed away. Clinically, we grade pitting edema from +1 to +4 based on the depth of the depression and how long it takes to disappear. Common causes include congestive heart failure, chronic kidney disease, liver cirrhosis, or excessive IV fluids. On the flip side, non-pitting edema features a firm swelling that does not leave a pit when pressed. This occurs because the swelling is due to a protein-rich fluid or lymph buildup rather than simple fluid overload. It typically affects the arms or legs. The skin may feel thick, and it doesn't improve easily with elevation. We most commonly see this in cases of lymphedema or severe hypothyroidism. Now let's explore specific localized types, starting with peripheral edema. This is fluid accumulation in the legs and ankles that often worsens as the day progresses. Key nursing interventions include elevating the legs above heart level, encouraging regular movement, monitoring daily weights to track fluid retention, and advising patients to avoid tight, restrictive clothing around their limbs. Next is pulmonary edema, a life-threatening emergency where fluid leaks into the alveoli, severely impairing gas exchange. Patients will present with acute dyspnea, crackles upon auscultation, and a classic pink frothy sputum. This is commonly caused by left ventricular heart failure or ARDS and demands immediate aggressive clinical intervention. Moving to the brain, cerebral edema is a neurological emergency caused by trauma, stroke, or infection. The fluid buildup increases intracranial pressure, restricting blood flow and oxygen to brain tissue. Watch closely for signs like severe headaches, projectile vomiting, altered mental status, sluggish pupils, or seizures. Early management to maintain the airway and lower ICP is critical to prevent permanent brain damage. Finally, we have ascites, the accumulation of fluid within the peritoneal cavity, usually secondary to portal hypertension from liver cirrhosis or malignancy. Patients will exhibit abdominal distension, a feeling of fullness, and rapid weight gain. Nursing care involves closely monitoring abdominal girth, tracking fluid restrictions, and assessing respiratory status as the fluid can press against the diaphragm. To successfully manage edema, we have to uncover the root cause through a comprehensive diagnostic workup. This includes imaging, like chest X-rays to check for pulmonary fluid and ultrasounds to visualize organs. Blood tests are used to check serum albumin levels and balance electrolytes. Lastly, urine tests look for proteinuria to rule out underlying kidney issues. General clinical management relies heavily on three core pillars: administering prescribed diuretics like Lasix to help the body flush out excess fluid, utilizing limb elevation to facilitate venous return, and ensuring strict daily weight checks to accurately monitor fluid changes. If you found this overview helpful, please hit that like button, share this video with your fellow nurses or students, and subscribe to Nandhini's Nurse's Nest for more high-yield clinical guides. See you in the next video.